Hello, everyone. I'm Carlos Lassiter, and thank you for joining me today. In the fast paced world of healthcare, our roles are constantly evolving, often putting us at the intersection of clinical practice and research. The way we communicate is the foundation of everything we do. Today, I want to take a few minutes to discuss some of the critical ethical issues and implications in research, specifically as they relate to communication among healthcare professionals. First, let's identify the core principles of scientific communication. These aren't just guidelines, they are the bedrock of our foundation of our profession. The first is clarity. Our research findings, especially those related to patient care, must be presented in a way that is easy to understand both for our peers and the public. Second, we have accuracy and objectivity. This means we report our findings exactly as they are, without bias or distortion. The data should speak for itself. Third, transparency and reproducibility are key. We must be open about our methods and data so that others can replicate our work and verify our findings. These principles are what build and maintain trust in the scientific community, and most importantly, with our patients. Now let's connect these principles to the ethical implications in human research. As allied healthcare professionals, we have a unique responsibility to protect our patients and research participants. The three main ethical principles guiding human research are respect for persons, beneficence, and justice. Respect for persons means acknowledging the autonomy of our patients, which is why informed consent is so crucial. Beneficence is about maximizing benefits while minimizing harm. We must always consider the potential risks to our patients and ensure they are outweighed by the potential benefits. Finally, justice ensures that the benefits and the burdens of research are distributed fairly. We must be mindful of not exploiting vulnerable populations and treating all participants equitably. When we apply these ethical principles to the communication process and research, specific issues emerge. One of the most significant is ensuring that informed consent is truly informed. It's not enough just to have a patient sign a form. We must communicate that the study's purpose, risk, and benefits in a way that they can fully comprehend. Another major issue is confidentiality and privacy. We have an ethical and legal duty to protect the identity and data of our participants and we must communicate with our team in a way that safeguards this information. Finally, we must be vigilant about data integrity. Misrepresenting or cherry picking data to support a hypothesis is a serious ethical breach that can erode the credibility of our work and the entire scientific community. Beyond research, effective communication is a daily necessity within our practice. When interacting with patients and their families, the goal is clear: compassionate and respectful dialogue. We should strive to use simple, non technical language to explain diagnoses, treatments, and care plans. Active listening is essential. It shows respect and helps us understand their concerns. With our colleagues, communication must be concise, accurate, and respectful. We must provide all necessary information in a clear and structured manner, whether it's during a shift handover or in a consultation with another provider. This kind of communication within our scope of practice is what ensures patient safety and a cohesive care team. Finally, let's talk about demonstrating effective skills in writing formal correspondence. In healthcare, this can range from patient notes and referrals to formal reports. A key, a few key points to remember are clarity, conciseness, and professionalism. Every document should be well organized and easy to read with a clear purpose, using a professional tone, proper grammar, and a correct spelling at all times. When writing, consider your audience. A letter to a patient should be different from a clinical report for another physician. Tailor your message and your language to ensure it is understood while maintaining the high standards expected of your profession. In summary, from the principles of scientific communication to our daily interactions and formal writing, ethics are woven into the very fabric of how we communicate. By being mindful of these principles and issues, we not only uphold the standards of our profession, but also build stronger, much more trusting relationships with our patients and our colleagues. Again, I'm Carlos Lassiter, and thank you.